Hello, this is Dr. Gay from First Look MRI, and this is a 57-year-old female who injured their knee playing tennis. She has several findings, but I'm just going to show two of these. And one of them is the semimembranosus tendon is partially torn, and it is right down here. It's something we don't see very often, but if we look in the posterior medial aspect of the knee, we see a tendon coming down here, the semimembranosus tendon. It comes down and attaches right back here. Often it'll be right next to the joint capsule, and they'll also have injure the joint capsule or tear that when this is torn. But this is a tear along the inferior aspect, and this is associated with a tear of their medial collateral ligament or a sprain of the medial collateral ligament. And it comes down. We should see a nice dark attachment here, but instead we see this foggy brightness. We'll put up another view here to verify that. Here we go. Here we see the tendon coming down, down. Some of the fibers attach okay, about right here. But over here you see them torn, thickened. They peeled off a little bit from the tibia. So this is a semimembranosus tendon tear, a partial tear. We can see it over here even better if we look in the axial images. This is the semimembranosus. This is the medial posterior side. This is the gastrocnemius muscle, and there's that tendon. They touch each other here, and we can follow the semimembranosus down, 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 and right there it starts to become too bright. And right there, really bright, it's almost fluid signal. So this is where it's partially torn from the tibia. They also had a sprain of the MCL and a low-grade injury of the pes anserine tendons out here as well. And there's one other finding in this patient, which is their lateral meniscus root. At least several of their findings, but the one I want to show you. So this is a sagittal PD image. Here's the anterior horn, here's the posterior horn. And we're going to follow that lateral meniscus towards the center to see the meniscus root. So we're getting closer, closer, and on this view, between here and here, we see there's a loss of the dark signal right there, and then we see nothing here. We see something back here. This thing in back is the meniscofemoral ligament of Humphrey. It goes in front of the PCL, comes off the posterior horn here, and it goes across sideways. It attaches close to the PCL here. And that's intact, so that's holding on, but the meniscus root, which should be right there, is absent. Right there is absent. Right there is absent. And right here you can start to see some thickness. So this is the part that attaches to bone, right there, that little bit of fog. So a torn lateral meniscus root. And when these tear, sometimes the meniscofemoral ligament of Humphrey, or if it's in back, the Risberg ligament, those will hold on and it will not have much hoop stress. Loss of hoop stress. But in this case, there is loss of hoop stress. We can look on this view here, a coronal view, and we see the lateral meniscus body is pseudo-extruded. There's loss of hoop stress and a little degenerative type inner third tear and blunting of the inner free margin there of the meniscus. Abnormal morphology. So when we see this pseudo-extruded, you know something's going on. There's a loss of hoop stress, so look back for a radial tear someplace, or look for a root tear like this where the root is torn and the meniscus is able to drift outwards. And again, this meniscofemoral ligament right here next to the PCL here is hanging on, but not holding on as tightly, and so it's allowing the meniscus to drift outwards. So this patient had two findings: a partial tear of the semimembranosus tendon and a tear of the lateral meniscus root, and pseudo-extrusion of the meniscus, and a tear of the inner free margin of the meniscus body, and several other findings here. Partial tear of the distal attachment of the medial collateral ligament, a little edema underneath there, and that's it. So thank you very much.